life affects you, you know, and SMOC is a part of my life.
I think it's funny. I keep asking him, so you're going to do another 25?
I'm Sam Brown. I'm an orthopedic surgeon here at Sports Medicine and Orthopaedic Center.
Congratulations, Sam, on being here for 25 years and helping build our group into what it is.
I cannot believe Dr. Brown has been practicing for 25 years. Sometimes I think back on, you know, as long as I've been working with him, and then just 25 years rolled by so quick, and I know he probably feels the same way.
I expected him to be here this long and longer. He loves what he does.
He's a gifted surgeon, and 25 years is great, and I hope he's around another 25 years because his talent is needed.
I'm an orthopedic surgeon, but I specialize in sports medicine, and as we talked earlier, I do that because I liked sports-related injuries, and I did a one-year fellowship after residency, you know, to give me some extra training in that. And I was really fortunate to be out at the Curl and Job Clinic in Los Angeles, where Frank Job, who's like Mr. Shoulder Surgeon of the world a long time ago, was practicing, and so I learned to do rotator cuff work and all from Dr. Job.
Dr. Brown certainly is a very large asset to our group, especially in the niche that he provides with his expert care of athletic shoulder injuries.
He's a great doctor. He is really into patient care. He loves his patients.
Patient care is, you know, obviously the heart and soul of medicine.
Dr. Brown is an excellent guy to work with. He is calm. He is very considerate of his patients and the other doctors.
His personality was down to earth. He didn't look down his nose at you, so to speak.
I think the one thing that makes Dr. Brown a good doctor, there's not necessarily just one thing, I have to say that. There are a number of things that come to mind for me, but I feel like he sincerely cares about his patients.
He sits and explains exactly what will be going on, what the problems are. He's very active in calling them and making sure that things have gone well after the surgery, talking to referring physicians. The patients that have dealt with him have very positive experiences.
He knows how to put things in perspective for people as far as keeping them in layman's terms so they understand what's going on, and a lot of physicians don't do that.
It's good. You get faith in him and know he's a skilled surgeon, and not only a skilled surgeon, but I was in the sales field for 37 years, marketing and sales, and one of my traits, I think, is knowing people, and he's a good person. So yeah, he's a good person, and you get a good person, a good surgeon, you got something.
Some of the greatest rewards that come to me are people who are not necessarily the world's greatest athlete, but they might be a weekend athlete. They've fallen, had a really serious rotator cuff tear, and often they'll come here and they've been told somewhere else that actually, well, gosh, this can't be fixed, or, you know, we just don't operate on these anymore. And then we take that patient, fix their tear, and get them rehabbed so that they go back to their weekend athletics or whatever it is.
Dr. Brown, I appreciate what you've done for me. You've got my arm healthy. Look at that, man. Look at that. But I wish you a happy 25 years and another 25 years. I'm hoping you're around to help a lot more people, because your talent is very valuable.
Like I've said before, and I said during this interview, there's a reason I send so many people to you. I trust in you, and I find it an honor to be not only a fellow employee or coworker, whatever you want to call me, but also a friend. And I really have enjoyed my time working with you.
Congratulations on your 25 years.